بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. آمين وأجمعين. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. I started the spot diagnosis series in Neuroradiology, hoping these spotter cases help you in your examination. Here, this is our first case, and as we see here, this is spondylolysis, as we see defect in the pars interarticularis. Here, a cystic lesion, and this is left second bronchial cleft cyst. Here we see enlargement of the intraorbital muscles due to thyroid orbitopathy, giving the appearance of Coca-Cola bottle sign. Here, a case of carotid cavernous fistula, as we see here, and there dilatation of the superior ophthalmic vein. Here we have lacunar skull of a newborn with multiple Wormian's bones. Can be normal variant, can be associated with Chiari malformation. Here, this is dendritic cyst seen. Here, hyperdense middle cerebral artery sign, and this is due to thrombosis of the M1 middle cerebral artery segment. Here, acute subdural hematoma on the right frontal region. Acute epidural hematoma on the right frontal region. Here, we have macroadenoma with fluid level, blood level, resulting in pituitary apoplexy. Here we have leptomeningeal cyst or growing skull fracture. The same case. Here a patient with eosinophilic granuloma, as we see here, bony defect in the parietal region. Here we have sinking skin flap syndrome. Here, patient with cystic lesion, and this is periapical cyst. Here we have patient with Chiari 1 malformation with syringomelia. Here, patient with eosinophilic granuloma with bull's eye sign or bottom sequestrum sign, as we see here. Here, patient with metastasis. Here, patient enhancing lesion in the splenium corpus callosum due to lymphoma. Here, patient with duplicated foramen transversarium bilaterally. Patient with posterior cerebral artery infarction on the left side. Here, patient with maxillary odontogenic keratocyst. Here, patient with atretic cephalocele, patient with hydatid cyst on the left side, meningioma, typical, cholecystoma on the left side, sinking skin flap syndrome, two cases of classic middle cerebral artery infarction, anterior cerebral artery infarction with bilaterally, although it is rare, colloid cyst, as we see here, with hydrocephalus, calcification in the cerebral falx cerebri calcification associated here with frontal hyperostosis, patient with ruptured intracranial dermoid cyst, patient with amyotrophic lateral sclerosis, cytomegalovirus infection, bilateral symmetrical calcification noted around the ventricles, classic case of middle cerebral artery infarction, old middle cerebral artery infarction, patient with progressive supranuclear palsy, and this is the hummingbird sign. Patient with multi-system atrophy with hot cross sign, as we see here, depressed fracture on the right side, hydatid cyst bilaterally both cerebral hemisphere, multiple nodular foci of cavernomas involving both cerebral hemispheres, Sturge-Weber syndrome on the right side with hemiatrophic changes, the same patient with MRI, another patient with Sturge-Weber syndrome on the left side with calcification, right subdural effusion with subfalcine hydrocephalus, with subfalcine herniation and dilatation of the left lateral ventricle, patient with adrenoleukodystrophy, typical patient, cavum villum interpositum cyst, classic case, MRI with the same patient, patient with neurocysticercosis with cyst with dot sign, subarachnoid hemorrhage seen bilaterally, diffuse hypoxic brain injury with white cerebellar sign, ectopic posterior pituitary and hypoplasia of the anterior pituitary, filling defect and the pituitary due to microadenoma, patient with L4 bilateral pars interarticularis defect due to spondylolysis, fracture base of the skull with raccoon eyes, subluxation of the subluxation of the C5 over C6 with cold trauma, contusion, odontoid fracture after fixation, before and after fixation. And these are the types. This is type 3, hangman fracture, as we see here, CT, plain film and CT and MRI. Cord contusion with fixation, anterior decompression and reconstruction, bilateral facet dislocation, C5, C6, Favre's disease or syndrome, basilar artery infarction, thrombosis or infarction, as we see here. And this is hyperdense sign of basilar artery with infarction, cavernous malformation, retropharyngeal abscess, as we see here. Don't forget where the site of extension, and the complication, ossification of the posterior longitudinal ligament, as we see here, spinal canal stenosis, epidural hematoma with ankle herniation, intracerebral hemorrhage, as we see here in the left side, brain abscess, typical brain abscess, grade 3 germinal matrix hemorrhage, and these are the classification of germinal matrix with ultrasound, as we see here. Subdural empyema bilaterally, bilateral subdural hematoma, classic case of hemangioblastoma in the left cerebellar hemisphere, coronal CT scan with left halar cell with nasal septal deviation and increased intracranial pressure, patient with copper beaten appearance and widening of the suture, cavum septum interpositum, cavum septum, sorry, Vergi, cavum septum pollicidum, epidermoid cyst, classic appearance, hangman fracture, as we see here, of the C2 vertebra, large cella tersica, patient with acromegaly, thickening of the skull, protrusion of the mandible anteriorly, Joubert syndrome, molar sign, Dandy-Walker malformation, copper beaten skull, patient with increased intracranial pressure due to craniosynostosis, as we see closure of the sutures, hemivertebra here with scoliosis, Classic case of osteoid osteoma, absent septum pellucidum with dilatation of the ventricles, craniofacial fibrous dysplasia, classic appearance, typical appearance of brain abscess on the right cerebral hemisphere, large adenoid gland, lemon sign, classic sign of Chiari malformation, and with the spina bifida, spondylolysis bilaterally, L5, striation, vertical striation, cordoid appearance, or classic for hemangioma, vertebral hemangioma, L4, hyperplasia of adenoid lymphoid hyperplasia, adenoid lymphoid hyperplasia in adolescent, hypostosis frontalis interna, schwannoma, left side with enhancing, bilateral subdural hematoma with the fluid appearance, bilateral closed lip schizencephaly, this patient has multiple sclerotic lesion, lymphoma, why not metastasis? Medical sign it is not involved. Middle cerebral artery infarction, a classic, with cytotoxic edema and mass effect and herniation, pericallosal lipoma or lipoma of corpus callosum, perimesencephalic hemorrhage, cavernous angioma, as we see here, popcorn-like appearance on the dorsal bones on the left side, herniated disc on the C5, C6 with compression on the thecal sac on the right side, ossifying fibroma on the left mandible, subdural hematoma with mass effect, subfalcine herniation and ankle herniation, bilateral subarachnoid hemorrhage, thalassemia patient typical case of tuberous sclerosis with angiomyolipoma of both kidneys, craniofacial fibrous dysplasia, subdural emphysema with diffusion here, restricted diffusion, retinoblastoma on the right side with calcification, dish, diffuse idiopathic skeletal hyperostosis, metachromatic leukodystrophy, flare images, and you see the sparing of the U fibers, ivory vertebra, ankylosing spondylitis with bamboo spine, absent pedicle sign or winking old sign due to metastasis, butterfly sign or vertebra, aneurysm on the left side, internal carotid aneurysm, patient with posterior reversible encephalopathy syndrome or BRIS, banana sign, lemon sign, subedural, epidural. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك. This is the first lecture of spot diagnosis series regarding to neuroradiology. Hoping you like it and see you soon on the next lecture with thoracic imaging, inshallah.